what is more important is a mom's mental health. Suddenly you are responsible for this new human being. There is anxiety about baby's health and well-being. There is this pressure we put on ourselves to do everything right. The kind of parenting that we have seen greatly influences the kind of parenting that we will do with our child. For a long time I thought it was just me, but the more moms that I spoke to, I felt this is such a common experience.
Welcome back, Divya. Divya, in this episode, I want to touch upon, with childbirth, a woman's way of perceiving herself changes drastically. And there is the concept called postpartum depression. I would like you to speak about this, elaborately.
Let me begin with my story, okay? I had the best healthcare possible. I was totally prepared. I had a lot of family support. And there were periods that in that immediate postpartum where I still felt sad for no reason and still felt really anxious about my newborn's well-being, and it was very confusing because I couldn't attribute to a particular reason, but all these feelings were just there. And then I realized that this is quite normal for many moms. It's not necessary that every mom should have it, but many do go through varying degrees of it. For some moms, it's very severe. For some moms, it could be mild. But if you feel you're struggling with it, you should definitely take help. Now, let's look at why this happens. Now, suddenly you are responsible for this new human being, especially if you're a first-time mom. You are still learning. It's a steep learning curve, and till now the focus has been on you when you were pregnant and family pampering you, but after the baby comes, the focus is suddenly shifted to the baby. And after the initial few weeks, the dad returns to work after paternity leave, and the novelty of the baby is gone. Everyone is minding their own business, and then you feel like you are figuring this out on your own. So there's that sense of isolation that a mother sometimes has. There is anxiety about baby's health and well-being. There is this pressure we put on ourselves to do everything right, to get everything right. There's a constant list of things that we think need to be done in a certain way. So all of this contributes to postpartum depression. Also, the way we perceive ourselves, the way we see ourselves, our roles have changed. We are staying at home with baby all day. Our bodies have changed. There is a sudden drop in hormonal levels. So your hormones take a little bit of time to adjust. They are all over the place initially. You are feeding on demand. The baby constantly needs you. So all this is quite stressful.
Is it okay for a mother to feel burdened by her infant or not want to feed, her child? Because I have had friends who have told me this.
That sometimes happens. Even I have had moms who come to me and say, I can't breastfeed. It is not something that I'm able to do. I'm feeling averse to it. And certain moms have this nursing aversion where the minute they put baby to breast, their skin crawls. They get this very wanting to pull the baby away and not do it at all. So that is also normal for some moms. And in such cases, I ask the moms to prioritize mental health because yes, breast milk is the best food for baby, but what is more important is a mom's mental health. Only if the mom is taking care of herself, is happy, is at peace, can she be taking care of a baby who's totally dependent on her.
Through your role, are you also in a position to counsel the family?
Yes, many times we do work with the family because I think lactation specialists are in this unique place where they are looking at mom and baby as a whole unit, and they are focusing on the wellness of both mom and baby. So doctors, families and all may be focused only on baby and baby's growth and baby's development. So we are focused on both mom and baby thriving in this relationship. And if that needs family support, if that needs family understanding certain things about what the mom is going through, we are there to close that bridge that gap.
So, what are the common aspects you tell a mother to be focused upon with respect to herself for the well-being of an infant?
So, a mother should be taking care of herself also, not be hyper focused only on baby. Many moms are hesitant to take help. They want to do everything by themselves in the initial days, whether it is a lack of trust about others' ability to take care of the baby, or some feel this possessiveness towards the baby. But I'm here to assure them that it is okay to take help, because we were meant to do this as a village, right? All through evolution we were living in groups and doing this together, but now suddenly there are nuclear families and moms on their own all day at home taking care of the baby, and that is not an easy thing to do, be without adult interaction the whole day, only with a baby the entire day. So I encourage moms to do, see, self-care need not be about going to a spa or going to a gym. It can be small things that they can do while at home. So, if it means napping while the baby is napping, if it means making yourself a cup of coffee and enjoying it, eating your favorite snack, going for a 10-minute walk while wearing your baby, meditating for 5 minutes while baby is asleep, listening to your favorite podcast in the background. So, do things that you like, because only then does this become sustainable. Being a primary caregiver is a big role.
Is there a story that you can share which was a pivotal moment in your career which really, made this entire journey for you concrete that yes, what you're doing is essential for society?
Because when I initially went through this transition, I thought maybe I am the over anxious one who's going through all this. Maybe because whenever you're talked to about motherhood, right, till you actually become a mom, everyone paints such a rosy picture. You see all these pictures of happy families with babies, and the mom is so in a blissful state, really enjoying motherhood, and everyone's really happy. And you don't see the hard work that goes behind it, the effort that goes behind it, and the sleepless nights and the huge workload that is raising a baby. And so for a long time I thought it was just me, but the more moms that I spoke to, I felt this is such a common experience, but no one comes out and talks about it. No one prepares moms who are entering this stage that this is going to be tough, but you are going to get through it. And I wanted to be that support for moms who are going through this, to give them that confidence and strength in every way possible.
What are the signs and symptoms that a family can look out for, in order to help the new mother in their family?
If a mom is unable to connect to her baby at all, does not enjoy being around her baby,
Most of the time the woman never even
expresses that. So the family needs to observe that closely. If the mom is aloof, not wanting to interact, you see bouts of crying, bouts of shutting herself out, not doing anything to take care of herself, not eating well, not talking on phone, not like wanting to interact with other people. All these are signs that the family can observe and encourage the mom to take help, even if they are not able to directly encourage the mom. Also, being empathetic towards what she's going through, supporting with the baby as much as possible, all these things can help too.
I think, after a baby comes into the home, guests coming in, and that's like a huge thing in a new mother's. How do your patients, how do your new moms typically handle this?
So I think that is something that moms really struggle with, because many of us are wanting to please people. We have grown up in big families where visitors coming home all the time is the norm, especially in India. And as soon as the baby is born, everyone, people who have not seen you for years together, want to come and see the baby and congratulate you. And even if you don't want to, there are elders at home who are saying it's okay, it's just 5 minutes, let them come and see. And then you'll be breastfeeding and they'll be like, is the feeding over, this person wants to come and see the baby. Or they'll not care if the baby is sleeping. So there's this, it's all because people are genuinely happy for you and the baby, but they have to understand that it is some kind of intrusion. A new mom needs a lot of private moments with her baby where she's bonding with the baby. She needs to be in a relaxed state of mind. She might not be in the mood to entertain people or make conversation with everyone. Till a mom feels ready, visitors shouldn't be encouraged by family. And also for the baby, till the first 6 weeks, till the baby gets their first shots of vaccine, it's best if too many outsiders do not come and handle the baby, because every person coming again wants to handle the baby, wants to kiss the baby, wants to give the baby something, or ask the mom, is your milk coming, or ask such personal questions. Oh, was what kind of birth it was? Did you have a C-section? So these are things that the mom will not want to talk about immediately after birth. She's still processing some events from the birth, and she's still navigating this path. And it's best if they are left alone to do it at their own time and pace.
How do you support a husband? It's a baby being born is not just an experience for the mother, it's a journey for the father. Do you have a role to play there as well?
Actually, even fathers can have postpartum depression. They can also have anxiety. The relationship between the wife and husband changes a lot after a baby. Suddenly, baby becomes the focus of everything. They might lose communication if they are not communicating well. They might lose touch. Mom might be too focused on baby. Dad might miss mom in a way that she was available to him before. Also, even when they are okayed by the doctor to resume sexual activity, moms may not be in the frame of mind. Their libido drops when breastfeeding. That is nature's way of spacing pregnancies, so that mom has enough gap between two siblings so that she can give attention to each one of them. And so there could be all these kinds of changes. And also, when it comes to parenting, the mom and dad might be on different pages as a baby grows older, because all of us have a childhood that we come with, and some kind of baggage from that childhood. The kind of parenting that we have seen greatly influences the kind of parenting that we will do with our child. And unless we actively work on that and work on getting on the same page regarding what is non-negotiable for you, creating some basic house rules, basic common parenting ground, many parents struggle with that also. They do not understand that there were these differences that existed that suddenly come up after a baby is in the picture. So it is a crucial adjustment period for a couple also. There are many couples who go to therapy in the first year after a child is born, because there are so many differences that suddenly crop up and so much to navigate that it is quite challenging.
When my son was born, a very big topic of discussion was having a ayah for doing malish for the child. Now, I really want to understand, because I never allowed for that. I used to wonder, am I doing something wrong for my kid because his bones will not be strong enough without the ayah? But one pediatrician had told me that only you should touch your child. So that was something, it was in my head. I would like you to talk about this, Divya.
Correct. So a newborn baby is quite delicate and sensitive. Should be handled only by the parents if possible. See, the baby doesn't need to be given a bath every day in the initial few days. Baby is not getting dirty, not getting soiled. So till a mom recovers and she feels ready to be able to give massage and bath to the baby can just be wiped. Baby need not even be given a bath. Okay, once the baby is ready and the mom is ready, or the dad can also contribute, one of the parents preferably, because our touch is what the baby is seeking. Our touch is what the baby wants, and no one else's touch can be as gentle and loving as a parent's touch. So they can start with gentle massage of the baby and give the baby bath on their own. So all these there is this system here where an old lady comes and she's handling the baby really roughly. This exact same thing happened to me also, where old elders brought in a person to massage and this person will come with their own advice. Like sometimes there'll be like the newborn's breast can have some milk, and these ladies suggest squeezing the milk out.
And the
that can be a
nose.
very pulling the nose,
Yeah.
or cleaning the ear with a cloth, or very roughly pulling the hands and legs, or
To relieve gas.
correct, and giving the baby bath with very hot water. All these are actually not at all recommended. Some of these can even be dangerous, causing infections and other things. So it is best if mom, because massage is a bonding activity, more skin to skin between a mom or a dad and a baby, more oxytocin release. It is a loving, gentle activity. You can enjoy it. You can use that as a special time to spend with your baby.
And I just want to understand, like, see, nowadays girls and boys, all babies wear diapers. So, are there any do's and don'ts while using a diaper for your baby?
If you are using, see, disposable diapers or cloth diapers, it is totally your choice. It depends on your convenience. We cannot say that cloth diapers are, not every family can cloth diaper their child. So, if you're using a disposable diaper, make sure that you change them often, because we don't want the diaper to be wet or soiled for a long time, because when that wetness or the poop comes in contact with the baby's skin, it can cause a rash. So just to maintain proper hygiene, change the diaper every 2-3 hours, or as soon as you see that the diaper is full, more frequently for newborns. Wipe them clean, air dry them. You can use something like, in South India, we use coconut oil, but depending on where you are, you can use whatever oil traditionally is used in your family to just create a protective barrier between the skin and the diaper, so that baby does not feel the wetness. And if it's a cloth diaper, then again, the only rule is to make sure that baby does not feel the wetness and you're changing it often.
And another thing that I used to come across and hear as a new mom was, at regular intervals of time, take your baby to the washroom, and then that trains the child to pee at a particular time and poop at a particular time. Is that true? Can you build that
There
habit?
is emerging evidence about something called elimination communication, where this is advice, and it is I don't know how much proof there is to it. I have not done that research, but this is an emerging, I won't say trend, emerging science, that if you take the baby to the bathroom and help the baby, baby will be toilet trained faster. But there is also an contrary school of thought, where we wait till the baby is able to understand, we wait till the baby is able to respond, because it is believed that it is a physiological thing. Ability to tell a parent that, oh, I want to go to the bathroom now, it is a physiological milestone that the baby has to reach on their own. So there are both schools of thought. There is evidence for both. So I think it depends on what you as a family want to do.
And now, as I have been talking to a lot of doctors through this channel, one of the common trends I observe is a lot of young women are anemic today, and a lot of women are working women. So, how can a woman's body is designed to reproduce? What should a woman do? And from as a mother, as a young adult, what are the things that a woman should keep in mind so that the child, who a child which she'll have in future, is very well nourished?
So there are few things you can do. These days, couples even go for preconception consultation with their doctors. So before they plan to have a baby, they can actually go to the doctor, do their blood work, see if they have to start supplementing with iron or other vitamins, and see if everything is okay, and then begin their conception journey. So that is also a kind of planning for pregnancy, and that is something they can do. Even otherwise, when you're trying to conceive, cutting down on processed food, cutting down on sugar, focusing more on eating at home, eating lots of fiber, lots of variety of food, protein, lean meats, eggs. So nutritious food at home will really help. When you say anemia, another thing that is there for the baby. Now the baby gets its iron reserves from the mom. So as soon as the baby is delivered, if we wait to cut the cord till it stops pulsating, it is said that more blood is transferred from the mom's body to the baby, and therefore baby's iron reserves will be slightly higher, and there is less chance of iron deficiency in the baby. So that is something that you can include in your birth plan and consider if you want to do a delayed cord clamping.
What are the typical steps, while you make a birth plan for a mother?
So a birth plan can include things about who you want in the birth.
Do you have a set of?
Yeah, we do have sample birth plans. Or see, during our prenatal classes where we are preparing the mother for labor, for birth, there are so many things that you can include in your birth plan, like what are the scans that you want, when you specifically think about labor, who are the people you want around you during labor? What kind of interventions do you want? The IV fluid. There are certain hospitals that have routine interventions that they will give you the IV or something. So understand from your doctor, have a conversation with your doctor. Many times I find that the doctor visits are not two-way. It's just doctor checking that everything is fine and the visit ends there. But you can ask your doctor these questions: what is standard protocol in this hospital? Tell them what you want. Tell them you don't want a routine episiotomy. Tell them
Can
I
a
am planning.
mother opt to take you along for her consultation?
Yes, because I'm a birth doula, I also go along with the mother for consultations, and we discuss all these things with the doctor till the mother is satisfied. So the mother can say, I want to be able to walk around when I'm in labor. I want to be able to try laboring in different poses. I want to carry my birth ball to the room. I want to have some music in the background. I want to make sure only my partner and my doula are there. Do not allow any other family members. There are so many things that you can talk about. What do you want
I've
once
heard
the babies
of
come?
this water birth.
Water birth, yeah. So there are certain places that offer water birth. It is still not available widely. Many doctors do not want to experiment with it because they feel that there is not much evidence, or not, they haven't had a opportunity to practice it much. But
But does it actually reduce the pain for the mother?
Yes, it is regarded as one of the most gentle ways of birthing the baby, and it reduces the being in water actually reduces the pain for mother. In fact, even in places that do not allow water birth, water can be used as a medium of coping with pain. So when the mother is in early labor, pouring warm water over her pelvic area and her hips, or mom standing under a shower, all that help greatly with coping with pain.
I remember a cousin of mine, her mother used to tell her to have a lot of egg or anything made with castor oil to induce labor. Is that true?
So this is a very common home remedy that is suggested, but there is no evidence. And also castor oil can cause a lot of discomfort. It can cause diarrhea. So
Maybe that induces labor.
You will not want to go through that discomfort in addition of discomfort of labor. So yeah, better to avoid such methods of induction.
So, to wrap up this conversation, Divya, I want to understand what should a mother, when should a mother reach out to you? When should a woman actually reach out to you? At what point of time in her journey of pregnancy or pre-pregnancy or post-pregnancy should she reach out to you for help?
So, if we are talking only about lactation, then prenatally, when she's in her third trimester, it's a right time to learn about lactation, learn about how your body makes milk, what to expect in the first few days at the hospital, what is baby's normal behavior, what are the different ways to position the baby at your breast, and how to choose which position will work for you, how to identify if the baby is latching correctly and transferring enough milk. So complete education about breastfeeding before the baby arrives. After the baby arrives, we can help the mother with hands-on postnatal support, where we are positioning the baby, assessing the latch, helping mothers with problems of oversupply or low supply. In case of twins, then we are helping the mother feed both babies at one go. If there are premature babies, then how can we help the mother pump if the baby is in an ICU and make the milk available to the baby? So different scenarios. And through breastfeeding, whenever they face pain, anxiety, discomfort.
And from the perspective of mental health,
Whenever they need encouragement. So there are a lot of support groups these days, like Lalish Lalish League has a support group, and even on Facebook there are a lot of breastfeeding support groups available. Even if there's a local one where you live, you can find a support group where you'll find other breastfeeding mothers share their experience. So that itself inspires you, motivates you, doesn't make you feel like you're alone. Also, it's nice to have friends who are also breastfeeding, because then you feel like you're in the same boat. That is one thing I've felt with motherhood. It's really nice to have other friends who have kids in the same age bracket, because then you get to do it together and it feels more joyful that way.
would you like to share one message for a family who has just who has a baby in their home now?
A new baby. So I know it's an exciting period for the entire family, and entire family is really concerned about the baby and baby's wellness. But the mother needs a lot of support too. The mother still needs to feel encouraged, because research has actually shown that the more positive and encouraging people around her are, the better the mother is able to breastfeed. So their words, their encouragement, their tiny gestures of kindness and understanding, them doing their bit in helping her. If she necessarily may not want you to help with the baby, she may want to do everything for the baby herself, which is an understandable feeling, right? So without getting offended that she doesn't want you to hold the baby or help with the baby, help her with other things, preparing her meals, making sure she's nourished, giving her time for uh, making sure she's comfortable, making sure you are a gatekeeper and not allowing visitors inside. You can do so many other things than just helping with the baby physically. So make sure you understand the kind of help the mother wants.
Thank you so much, Divya. This was very enlightening, and I hope in the next episode we can touch upon points about working moms and their chemistry with their children. So, stay tuned for the next episode, guys, and please subscribe to my channel so that I can have more experts like Divya talking about aspects of health which are very pertinent and important for all of us to know. Thanks.